12 o'clock and we're gonna get started. So welcome everyone to another virtual program hosted by the Healthcare Council of Chicago. My name is Megan Phillip and I am the Executive Director of HC3. We are a member-led coalition of healthcare leaders and organizations that are influencing change in our local communities. Today, we will be joined by some experts from our local communities to address the state of legislation and policy in Illinois. Before we get started, I have a few housekeeping items. So this afternoon's discussion will be recorded and shared on our website, www.hc3.health, in the next few days. So if you have to leave or you would like to share this, that will be available for you. As we hear from today's experts, if you have questions, please use the chat function, which will be seen directly by our panelists and our moderator, and we will do our best to address them during the audience Q&A portion. So now, without further ado, I'd like to welcome our panelists to turn on their video if it's not already on. We have Nadine Israel, who has spent the last decade in the health policy and advocacy field in Illinois, working closely with other advocate and activist leaders across the state on issues impacting the Medicaid program, Affordable Care Act, mental health and substance use system, housing and state budget and tax policy. And she is currently the Vice President of Policy Advocacy at the AIDS Foundation of Chicago. Samantha Olds-Frey has nearly a decade of experience in healthcare and appropriations policy and is currently the Executive Director and Chief Executive Officer at the Illinois Association of Medicaid Health Plans. She is responsible for coordinating legislation, strategies, testifying before legislative committees, and working closely with state agency administrators to formulate and implement policy that positively impact their members. We are also honored to have Senator Heather Steens, who represents the Illinois 7th District in the Senate since 2008. She chairs the Appropriations and Medicaid Managed Care Oversight Committees and serves on the Appropriations to Executive Appointments, Environment and Conservation, Government Accountability, and Pension and Human Services Committees. And last but not least, Cyrus Winnett is the Senior Vice President of Public Policy and Government Affairs for the Illinois Primary Healthcare Association. He is responsible for effectuating public policy and legislation on both the state and federal levels relative to community health centers. Cyrus regularly engages the state agencies that have authority over the health programs administered by the community health centers. In addition to our incredible panel of experts, it's my pleasure to kick it over to my colleague, David Smith, who is the founder and CEO of Third Horizon Strategies and the co-founder of our organization, HC3, for the moderator of today's discussion. So I will kick it over to you, David.
Megan, thank you. And thanks to our four colleagues for taking time out of your busy schedules to participate in the discussion with us. And thanks to all of you who have logged in to also participate. We are going to spend a few minutes setting the stage on the environment. I'll share a couple of thoughts and then invite my colleagues to do the same. Then I have a handful of questions I know I'll want to ask, but we certainly want to be able to field questions from those of you who are participating virtually. And so I would invite you to do that through the chat features that are included in the app. We will end promptly by 1 o'clock for those of you that have participated in these where I moderate in the past. That's we want to be respectful of your time. So thank you. I thought I'd just say a couple of things to tee up at least some of the things I'm thinking about and their points of interest. And I won't go too deep into any of them because I know our four panelists will have much greater expertise than I will in areas of their interest. But you know, it is a pretty remarkable time. When we had set the timetable for this, we kind of thought a week and a day might be enough to have a little bit more clarity nationally. Should have anticipated, given 2020 is going to 2020, that wouldn't be the case, and here we are. And it's a bit of a volatile time. That said, there's not a lot of significant structural change in Illinois. And that gives us a good opportunity to think a bit about where we've been over the last year and where we're going. We'll have an opportunity, I think, in about a week in another one of these sessions to talk a bit more about the election results, the transition timeframe, the policy agendas for the new administration, the recession that we know is going to have an impact on the delivery system, the litigation with the ACA, but we'll probably stay a bit out of those areas for purposes of this discussion and really focus on all things in Chicago and in Illinois. And there's just a few things I want to kind of note, I think have some bearing as we go into 2021. The first being that I think we're at a place where we've kind of long predicted some financial stress on our state's delivery system and certainly the city's delivery system in the South and West Side. And we're really starting to see those cracks manifest with, of course, 3 big recent closures in Westlake, Mercy, and Metro South. But also an expectation on the horizon that inpatient volumes continue to decline, expenditures track with medical cost inflation, and we've done some modeling that we'll be releasing in a paper in the short future that shows over the next 5 years, we've got roughly a $2 billion unfunded liability with our safety net hospitals that given the plight and the challenges they're facing, we'll really need some help, or we're going to see more Mercy, Westlakes, and Metro South. So that's not an insignificant challenge that kind of sits before us. Second, of course, is COVID-19 and the budget climate that we're certainly walking into. I think most notably for the things we think about at the council has been the disproportionality of this pandemic on underserved communities, communities of color. We've been grateful to both the mayor and governor for their recognition of that issue and the leadership they've taken on that issue. A lot more has to happen. And if that's not the most stark clarion call for all of us to be more motivated to improve the nature of delivery in these communities, I'm not sure what is. You know, a third big thing this year is what I might just euphemistically call the MCO shuffle. We had a lot of mergers and acquisitions in the state, and some administrative systems moving from one place to another as we transitioned members, and some new blood in the marketplace, some leadership changes. And so that's been a big part, I think, as MCOs think strategically about their role in the state and administering the Medicaid program. We've got kind of a semi-new set of dynamics in that space. The suspension of the integrated health home program, which was announced by HFS in recent days. And to what degree does that show or paint a signal? And then we have a tremendous amount, number 5, a tremendous amount of collaboration and transformation activity taking place, certainly in other parts of the state, but on the South Side and West Side. There was the dissolution of the South Side 4, and then the reemergence of a South Side 3, and there's some chatter on the West Side around transformation initiatives, all kind of pointed toward this still to be legislatively approved $150 million in transformation funding. So there is no shortage of things to be thoughtfully considering as we go into a legislative session, and we go into what will hopefully be a less difficult year than 2020 in some ways, but certainly could be as difficult of a year in other ways. And so let's unpack all of that a little bit and talk through really what we should be expecting, what our priorities, and you know, how do we try to collectively move forward in 2021. So with that, we've asked each of our panelist colleagues to spend about 5 minutes just giving a view from their a view of their state of the world from where they sit. And maybe we could just go ahead and start with Heather Staines, who, as Megan said, is a representative in the state Senate and very active in healthcare issues. And Heather, look to your thoughts first.
Great. Well, thanks so much for putting together the panel and including me on it. Really enjoy that. So, you know, it's a very mixed world. I mean, obviously it's been tumultuous this year, and it's going to have some lasting repercussions. You know, big picture, no surprises. I mean, we all understand that one, with COVID not going away, that's going to have a continuing impact on both healthcare and the budget for the state of Illinois and how we're delivering things. You know, we had built the budget this year, you know, our fiscal year, July through June, with the presumption that we were going to get additional relief dollars from the federal government and looking towards seeing whether the fair tax would pass, which now we know post-election that it is not. So, you know, that leaves us, you know, at a $6 billion budget deficit that was built into the budget. Revenues are coming in a little bit higher than we'd expected, so that's going to reduce, but still significant challenges. So that's going to be the context in which all policy is going to have to get considered, is not going away. And how we come back to address that, I think it's going to be hugely important to many, many aspects. Obviously, the ACA and what happens with the Supreme Court decision, although at least what we're hearing signaling wise on that seems to be that that's not going to be going away. So hopefully no huge ramifications and changes from that. Hugely helpful in Illinois, where we have had, you know, hundreds of thousands of people sign up post ACA implementation, both through the expanded Medicaid piece as well as private health insurance. So that's, I think, hugely, tremendously important to our healthcare delivery system, that will continue forth, so it looks. You know, I also think that telehealth has been, you know, primarily within COVID, you know, it's been problematic news, particularly on really laying bare all the disparities in our healthcare system. One of the positive has been the expansion of telehealth and benefits we've seen coming from that. So that's one of the things that I'm looking forward to, trying to make some of those changes permanent within the healthcare delivery system, so that we can continue to really benefit and maintain some more access. You know, as David mentions, I don't think there's going to be ongoing pressures on consolidation. I think with COVID, though, there's a lot of pushback on allowing more closures to happen and decreasing access and services available in those neighborhoods that have been particularly hit hard by COVID and where we've seen such high disparities. So how we actually transform that healthcare system to bring better access into those neighborhoods is very important. And this panel, you know, represents a good variety of viewpoints on that. And I certainly believe that we have got to get much more preventative healthcare and various healthcare players working better together to deliver healthcare in communities, particularly low-income minority neighborhoods that really have been disproportionately impacted. And I think the healthcare transformation dollars are really being thought of. How can we help do that? Help to at least instigate and create additional paths for some of that transformation in those neighborhoods in particular. So I'll stop there and look forward to the Q&A at the end.
Great. Heather, I already have like 10 questions I just want to ask, but I'm going to be a disciplined moderator and move us forward. Nadine, Israel, let's, if you're okay with it, let's go ahead and look to you next, and would love to get your perspective on communities you're serving and what you believe are big risks or priorities as we go into 2021.
Yeah, thank you so much for having me. So AIDS Foundation of Chicago, so our kind of the population that we advocate on behalf of and alongside of are people living with or vulnerable to HIV and other chronic conditions. And so when we think about even just the last calendar year, so in 2020, and think about COVID, the killings of George Floyd, Breonna Taylor, and the uprisings that have happened since then, there is, if there was some unclarity or confusion about the root causes of health disparities or other social determinants of health, I hope that at this point there isn't, and that we can be in agreement, and I think we are, that structural racism is a public health crisis, and dismantling white supremacy, undoing racism, is what we need to do in order to address the root causes of the racial health inequities that exist in our country, in our state, in our city. So I think for us, and what we're looking forward to for next year, and part of what we think is going to be, at least in conversation, is to the points that Senator Steins brought up. We were very disappointed. We were very supportive of the fair tax, and we were very disappointed that the voters did not pass that constitutional amendment by the necessary votes. And that presents not only an issue, a structural budget issue for the current year, for next year, but ongoing. We have had a structural budget issue for decades in our state budget. And the fair tax was not going to solve all of that, but it was going to take a big bite of that problem. And so we believe that we need to continue to advocate for the fair tax, because long-term, that has to be a part of the solution in order for us to not be in a budget crisis year over year, whether we have COVID or some other issue that is causing revenue shortfalls. For when it comes to COVID and thinking about priorities, I know where the discussion is about the federal stuff at the federal level will take place at a different time. But what's important for us is we do need to see what happens with the Senate at the federal level. If the 2 Georgia Senate spots end up being under Democrats, that's going to make a huge difference of what kind of COVID relief package we could get at the federal level, which will have a huge impact on our state fiscal situation, I would imagine. We have our eye really closely watching what's happening at the federal. For that reason, it's going to have a direct impact on our fiscal situation at the state level, both when it comes to COVID, but when it comes to other relief for Medicaid and other SNAP and other programs. So for us, in addition to that, telehealth, as Senator Steins mentioned, has made a huge difference for access to care for the populations that we serve, and not just thinking about like a therapist appointment or a doctor's visit through telehealth, but even things like case management. So the ability to do case management, whether it's HIV case management or other types of case management over the phone or through FaceTime, has made a big difference. And parity in reimbursement for providers and protections for consumers to make sure that they're not paying any more than if they were doing telehealth and if they were doing an in-person visit. Those pieces are critical in a telehealth package that I'm sure will be discussed next session. And then the protecting Medicaid, so to Senator Steins' point about the importance of Medicaid in terms of an access point, without Medicaid, that's the card, right? That's your health insurance card for, thanks to the ACA, for over 1 million people in Illinois. And again, kind of keeping a close eye at the federal level with this US Supreme Court case, but also making sure that budgetary-wise, we protect Medicaid in Illinois and prioritize that budget. The last thing that I mentioned is that's kind of might seem tangentially related to health, but it's not, is the criminal justice reform package that's been discussed kind of peripherally, and I'm sure will be discussed again in next session. And the reason why I bring that up, I apologize. I'm having some technical issues, so I'm hoping y'all can hear me still okay.
You're great, we can hear you.
Okay, great. The reason why I bring that up is because so many, in terms of thinking about the racial disparities with healthcare, specifically for Black and Latinx people. If you look at the intersections between that and who is disproportionately impacted with our criminal justice system, it's the same populations, and specifically Black and Latinx men. And so we have to also be advocates in that realm. If we're healthcare advocates, we have to be weighing in and supporting our criminal justice reforms, because those reforms will help impact long-term the healthcare of the same communities, the same people that we're advocating on behalf of. So that's another area that we're watching closely. So I'll stop there and kick it back to you.
Nadine, thank you so much. We've not met before, but I can already tell you we would be and will be fast friends. I love the way you prioritized your comments, and resonates a lot with me, so thank you. Let's go ahead and jump to Cyrus with the Illinois Primary Healthcare Association. I'll just disclose on the front end that I regularly drink the IPHCA Kool-Aid. I am a strong proponent of community health centers. In fact, I puff out my chest when I'm talking to any group outside of the city and other parts of the country about what an incredible community of FQHCs we have in Chicago and in the state. So, Cyrus, what's on your mind as we get out of 2020? Not fast enough.
Yeah, no, thank you, David, and thanks, Megan, for convening this conversation. I also drank the community health center Kool-Aid, which is why I took this job a couple years ago. So the rest of 2020, not expecting a whole lot of changes, especially because the fall veto session was canceled. I think we'll see a lot of the policies and programs that were put into place from the pandemic to remain in place for now, for the foreseeable future. So moving into 2021, I think the biggest questions are going to be, so of those policy and program changes that were put in place under the pandemic, what's going to remain, and what's that going to look like? But then also, how do we protect our healthcare system? So as been mentioned, unfortunately, the fair tax proposal didn't pass, and our budget situation is bleak, to say the least. And I don't envy the tough decisions that Senator Staines and her colleagues in the General Assembly and the governor are going to have to make to pass a budget, but it's our job as healthcare advocates and providers to push back any cuts to the healthcare system, especially in the midst of a public health pandemic like this. As for IPHCA, our top priorities are protecting the healthcare system, engaging in healthcare transformation, and the expansion of telehealth. So in regard to healthcare transformation, it's been our position that we as a state and as a country, frankly, do not do a good enough job of investing in preventative medicine and primary care. We do not do a good job of keeping people healthy and thereby reducing their need for higher cost specialty care. And we also, as a provider community, do not do a good enough job of collaborating with one another. That's not to say there's not good examples of strong partnerships and collaborations amongst different provider types. There certainly are. There's just not enough. And we need state investment and regulations to allow for improvements in collaborations and partnerships amongst the various provider types to meet the needs of the communities and their patients. And in regard to healthcare transformation, it's also been our position that there is no such thing as meaningful healthcare transformation that does not address the reasons for which the underserved communities, predominantly the Black and Latino communities, were so disproportionately impacted by the COVID-19 pandemic. You know, if we're going to transform healthcare, we need to root out the inequities that have plagued our society and our healthcare system for far too long, not just put a Band-Aid on it. And additionally, the expansion of telehealth, which has been mentioned, has been, for us, it's been an absolute necessity during the pandemic, both in terms of allowing providers to continue seeing their patients, keeping them healthy, which is critical right now, keeping hospital admissions down, but also in terms of bringing patient revenues to more sustainable levels. But we've also learned that telehealth is a useful means of providing care, and that patients really like it. You know, I personally had a couple telehealth visits, and I can tell you they were absolutely wonderful. It was amazing, and we are seeing patients, in terms of their no-show rates are going down, patient satisfaction levels are going up, adherence to medication protocols and treatment protocols are improving. So telehealth is here to stay, and it's simply a matter of figuring out what exactly that's going to mean on a permanent basis. And it's important for us to remember and realize that telehealth should not and will not supplant in-person care. There's always going to be a need for in-person care. Telehealth is simply just another means of providing care and increasing service capacity. So thanks, and look forward to the conversation.
Thanks so much, Cyrus. Okay, Sam, I saved you for last because you're always so energizing and
Thank you,
motivating.
David.
Can
Thank
you
you.
like solve all the challenges everybody else presented and move us forward? Just kidding. Go ahead.
Thanks. Yeah. First, happy Veterans Day to anybody in the audience who's a veteran. Thank you for your service. And thanks for convening us, David and Megan. I really want to echo the theme that you've heard throughout from Senator Staines, Nadine, and Cyrus, and that is, I anticipate next year focusing on racial inequities and disparities within healthcare, taking a purposeful approach to tackling implicit bias within the healthcare system. Budget is going to be the theme, I think, of the legislative session and how we manage that. To give you a perspective of sort of what we're looking at in the Illinois budget, Medicaid health plans today are owed well over $2.5 billion alone. Which is really gets us to nearly the height of where we were in the Rauner administration. And that's, current, doesn't lead to sort of where we will be potentially, mid next year if there aren't, some changes. And then of course, transformation. How do we, I anticipate, much like Nadine and Cyrus talked about, telehealth being here to stay, especially within the Medicaid program. We've seen great success, decrease in no-show rates, increase in access to behavioral health. But with that comes a challenge, and that is we see inequity still with the expansion of telehealth and communities of color and rural communities not having the broadband access that they need, not having the technological supports, even providers. We often think of it, I think, just as members. How are we going to reach those members? But the providers not having necessarily the IT in order to consistently reach their communities. And so that is going to be a challenge I think we need to tackle. I think there are some ideas out there, but something we need to think about is just because we've expanded access to telehealth doesn't mean we've sort of, it's something we can check off the list and move on. There's still some real work that needs to be done there. And then with regards to transformation, I think Cyrus touched on this a bit. I know Nadine has as well, which is social determinants of health. So when we look at an individual's healthcare, we see that about 50% of sort of their outcomes, and it has nothing to do with their clinicians or with sort of the healthcare industry and system that they go to or they're around. It's social determinants of health. Do they have access to healthy foods? Do they have a space where they can safely exercise inside or outside? Do they have secure housing and know where they're going to be sleeping? The next night, the next week, the next month. When we think about managing diabetes or managing somebody's mental health or COPD, you can't talk about somebody's blood sugar levels or somebody's whether or not they're engaged with their social worker if they don't know where they're going to be sleeping, if they don't know where their next meal is coming from, if they're still unpacking trauma from gun violence or a myriad of other issues. It's sort of that hierarchy of needs. If we're not addressing those social determinants of health, we're not going to see the outcomes we need on the healthcare side. And so that is where I think we really we can't lose sight of in this discussion, is that as we talk about healthcare, as we talk with healthcare providers, as we think of clinical outcomes, we have to see people as people and acknowledge that they have social determinants of health that need to be addressed.
Sam, thank you so much. Thanks to all four of you. So, I mean, there's three big themes that I think begin to coalesce here and tell a story about the collective work that's got to be done. The first theme is that we know we still are each of us partial stewards of a system that has inherent inefficiencies and inherent biases. That is not a new piece of information. But the truism of that has been amplified because of the events of this year, and I think it's created a real exigence and needing to be addressed. The second, that I'll say a little differently, is that our social compact is changing. It changed a lot this year, the way we interact, the way we recreate, the way we have meetings and discussions, the way we seek care, or the way we look after ourselves physically, mentally, and otherwise. And that is going to have a profound change, not just in telehealth, but in the entire social compact itself. And the third is there's not going to be enough money to even keep doing the things we've been doing. We're going to need, we have to make major changes to the system, and we're going to have to figure out how to do that with less, where for years we've been asking for more and more and more. And so there's going to have to be, to Heather's point earlier, there's got to be a much different type or different types of coalitions, public and private sector coalitions that really come together to solve these challenges. And maybe that's where I'd like to start with the Q&A for the panel. I am a big proponent of this idea that pain, or the expectation of pain, is like the one universal thing that moves everybody. And there's no pain for an institution or an individual that's the same as economic pain. Like economic pain is a big motivator. Heather, let me jump back to you. And you referenced the non-approval of the fair tax and the lack of additional stimulus from the federal government have created what looks to be a potential $6 billion budget deficit. So let me ask two questions, and I'm going to ask a couple of you guys to layer in here in a second. Like, Heather, what is the best case scenario? Like, if the feds suddenly got all their stuff together and we saw stimulus and tax revenues went up, like what are you guys thinking about as the best case scenario and the worst case scenario? And have you started to put any thinking together about how to tackle the worst case scenario?
Well, this having budget deficits is not new to Illinois. So I think there's been ongoing iterations of different ways of trying to address the problems. So yeah, I mean, there's a lot of different ways to go about it. Obviously something on the spending side is going to have to be a part of it. But for context, Illinois, if you take out where we are with our pension issues on our operating costs, Illinois is one of the lowest per capita spending states in the country. We have been cutting there. There's some areas that there's been some investment over time, even on an adjusted basis, but primarily it's been reductions. Our number of state employees has gone from a high of 70,000 down to 50-ish thousand. I mean, you can go across the board, and that's been the case. Now we're going to have to do more efficiencies there, but that's going to be a challenge. So revenue options are always going to have to also be part, I think, looking at that on the table, and different ways of going about it. Now that we can't, we have one of the most regressive tax structures in the country. So I'd certainly been hoping the fair tax would pass so we could try to address that. There's other tools that we have, like the earned income tax credit, as if we do have to go into expanding revenue, certainly need to do it in a way that's going to protect our lower income folks, given they're already who are paying an overburden compared to other states. We have a very narrow tax base generally compared to other states. And tax policy always suggests expanding the base, keeping rates lower is a better way of going. So whether it's looking at the sales tax base, whether it's looking at how our income tax, what's actually included in that is based, trying to look at those kinds of things are always easier, but it's going to be painful. There's no way around it. I think all players need to come to the table and try to come in with solutions and be part of it, because I think with a fair tax, it just brings it closer to home that we're all going to have to really look hard and deep about what structural changes we're going to make.
Yeah, well, I want to piggyback off of that and talk about other partners coming to the table. And there's a bunch of categories you could have here, but Sam, let me jump to you for a second, and then Nadine, I'm going to come in your direction. Sam, 2020, if there's any business type that has been, at least in the short term, less affected by COVID, it's been health insurance companies. I know enough about underwriting cycles to know that isn't necessarily true, and that those aren't just savings and profits, that we'll see utilization tamp back up. We've also seen a lot of investment from MCOs. Blue Cross Blue Shield obviously made a really big announcement last week. What are you seeing, thinking, hearing from our MCO colleagues in the state, they recognize some of the collective challenges. They know the budget climate we're walking into. If 2020 was the year of the MCO shuffle, what's 2021 the year of for MCOs?
Oh yeah, there's a great question, David. And I think a lot of uncertainty. Illinois, from an MCO perspective, has sort of a lot of opportunity. It's one of the largest Medicaid programs in the country, but it's also a unique state to work in. We say that if we're paid within 2 months, we're paid on time. So, there are just unique challenges, and it's, we have, I think, as we talked about it all in our openings, we have a more bifurcated healthcare system than we see in other states. So there's a lot of work for the health plans to do in order to get that collaboration and to sort of get that connectivity, and care coordination presents different challenges here in Illinois because of that bifurcation, if you will. I do know, so we've been tracking utilization. We saw, not surprising, a huge dip in April, but really by July, we've seen, although we'll see how things change, we've seen utilization come back to near normal levels, or actually above normal levels in certain spaces. We saw areas where utilization did not decrease, both in long-term care, if you were in a nursing home, by and large, you stayed in a nursing home overall. And then pharmaceuticals. Again, you've had medications prescribed to you. You needed them, throughout the June and July. But we are anticipating, these challenges that we've seen to continue in 2021. I hope that we've seen a slowdown in the shuffle. We have 4 large players statewide. We have county care. We will see in July of 2021, or at least we're anticipating MMAI expansion statewide. So I think that'll be a benefit to our dually eligible members. And that would bring Humana statewide, whereas now they're just in the Chicago region for our dually eligible members. But I say every year that I would like more stability, and I've yet to find it. So I'm not holding my breath.
Yeah. Well, I want to dig a little deeper on a couple of those themes in a minute. And Nadine, I told you I was going to go to you next, but I'm going to switch the order, and you'll see why here in just a second. Cyrus, coming in your direction, maybe play off of anything you just heard from Sam. And I think in particular, what I'd be interested in your perspective on is the relationship between community health centers in the context of vulnerable communities and the safety net, and where there are opportunities to improve alignment, to improve performance, improve economic efficiency. What do you see as maybe big initiatives that could be pursued by community health centers individually and or with MCOs?
Yeah, so let me first say that I completely agree with Samantha. Our program needs some stability. There's, Medicaid managed care on a statewide basis been around for only a few years now, and there has been a number of changes that have made it difficult for the MCOs and the providers to operate within that system. So some stability would be welcome to everyone. Opportunities in community health center serving underserved communities. So I don't know how many people know this, but community health centers, our origination actually goes back to 1965, the year after the Civil Rights Act was passed in 1964, to fill healthcare gaps in predominantly Black communities. And that's what we've been doing ever since, providing care to underserved communities when care was not afforded to them in other places. And because of that, we have built ourselves up as pillars within the communities that we operate, and provide a great deal of trust both in the healthcare provided and the information provided through community health centers to their patients. And so we can be seen as a resource, a community hub, to help connect our patients with all the other various types of care that they need, whether it's hospital care, community health, or community mental health providers, other social service providers focused on things like employment, housing, criminal justice involvement, education. We can help be that hub to do what we've been talking about, and that's increased collaborations and partnerships amongst the various provider types to take advantage of all the different things that all of us do the best. But then for community health centers ourselves and working with the MCOs, one thing that we want to focus on, because this goes back to the question around the budget and the allocation of resources, because we've been talking a long time, we need a greater amount of we need a greater amount of funding, but it's not just more funding. It's also a question of the allocation of funding, because there's always only going to be a finite amount of resources available. And how does the state prioritize the allocation of those resources? And what's been our position, and I think, I recognize it's easier said than done, and we're seeing greater recognition of this, is there needs to be prioritization of keeping people healthy. And for us, we see ourselves as community health centers playing a critical role in keeping people healthy. That's what we do. But we know that we can do even better. So one thing that we are focused on is payment and practice transformation. Everything we do right now is, the way we're reimbursed, it's a billable provider doing a billable service. And come on, there's a better way of providing care. We do a good job within that construct, but there's a better way of providing care. Taking full advantage of all the members of the care team, not just the doctors and the advanced practice nurses and the physician assistants who are the billed providers, but other, highly trained but not clinical providers and members of the care team. And what payment transformation will allow us to do, and COVID has shown just how important this is, because, scary as it is to say, something like COVID could happen again. But besides that, the ability for providers to have the flexibility to meet the needs of their patients and not necessarily have to try to tie everything to a billable service allows us to provide them care in a better way, create efficiencies, and improve outcomes. And we need payment transformation to provide us with those flexibilities, but we also, at the same time, we have to do our part and adjust the way in which we provide services. We have to engage in practice transformation, meeting people in a new way, and that's why telehealth is so important. And telehealth, not just picking up the phone and calling the doctor or doing a Skype conference like we're doing right now, but think of telehealth as care provided in any means in which the patient is in one place and the care provider is in the other place. And this is incredibly important, and something I think we'll talk about some right now, but the advent of 5G technology and the opportunities that will make available to the healthcare system, internet connected home blood pressure cuffs and glucometers, and like all these different things that you can use in combination to take full advantage of technology in the healthcare space is going to be incredibly important, but that flows directly into the conversation about payment and practice transformation. They all go together as one.
Thank you, Cyrus. Nadine, sorry. One more for Samantha before we switch topics, and I got you, just forgive me. Samantha, are NCOs ready for payment reform, payment transformation? Who's going to lead the way here?
Yeah, so I think we've already seen a little bit of both. So first and foremost, there's already been certain FQs and other providers that have already have alternative payment models, already have capitation or risk-based contracts with health plans, some that are full risk. So that exists today. But we want to get more, we want to bring that to more providers. We want to see more providers where payment is tied to outcomes, where there's shared risk, and where we can transform that healthcare system, because we agree right now, if payment and is simply tied to sort of specific codes or specific, encounters, but not necessarily outcomes or what a member needs, then we're not going to transform. You can't, because a provider needs to ensure they have stable revenue in order to keep the doors open. And, health plans are going to pay for what they can reimburse for. And so you're kind of locked up in that situation. We've already seen some of our health plans come out with alternative payment models for FQHCs in the last few months. We've seen, through some of the investments that plans have made during this time period, expansions or, in quality payments and sort of aligning our quality incentives that the plans have with those that the providers have, and trying to sort of move down toward a more transformative system, separate and apart from what goes on